Alzheimer's Disease, The Long Goodbye, by Carlos del Bosque.
Aceres Diaz.
Amanda C. Peña.
So it was first in 1906 by Dr. Alois Alzheimer, discovered as a peculiar disease during an autopsy of Augustus Dieter, a female patient that during the autopsy they found abnormal deposits in and around the nerve cells of dramatic shrinkage. 1910 is when it was given the proper name, just 5 years before he passed away, and it wasn't until 1931 the electron microscope that was discovered allowed 1,000 magnification in order to better understand the brain. So that's our little intro right there.
So now going into the etiology. As we know, Alzheimer's is a type of dementia that causes problems with memory loss, thinking, and behavior. Now there's several factors to which cause a person can have Alzheimer's. In a healthy person, the brain is able to transfer signals such as feelings, sensations, and thoughts from one neuron to the next. Now we look into the brain of a person with Alzheimer's. We see these types of signals are not being processed. Let's see. Yeah, okay. When neurons communicate with one another, it is through electrical charges which travel through the axons, releasing chemicals to another axon. The cells such as the astrocytes and microglia help neurons stay healthy by clearing the debris within one another. People with Alzheimer's have changes in the brain that causes this balance to be destroyed. Some changes actually happen years before seeing the symptoms, so that's why it's very hard for it to be detected beforehand. Some researchers have found that two proteins involved, such as the beta amyloid and the tau, are some of the causes which they become toxin into the brain. And it appears that the tau accumulates inside the neurons, causing it to tangle within the beta amyloid. And then it starts like a plaque around the neurons, which stops the communication between the neurons. That's one factor. Another factor we found was the vascular system may fail delivery sufficient blood and nutrients, causing the lack of glucose needed to power activity. Chronic inflammation starts to appear, and the microglia cells fail to remove those debris and astrocytes, which respond to destroyed microglia. Now, while this is happening, the neurons lose their ability to communicate. As neurons die, the hippocampus, which helps in learning and memory, starts to shrink. So people then to start have those memory losses, language problems, and unable to make decisions. People then, now while losing these neurons throughout the brain, a person with Alzheimer's starts to lose their ability to think, remember, and function independently. So they're completely dependent of others. Some of the epidemiological data that we found is an increase of 39% of deaths from 2000 to 2010 of people dying from Alzheimer's. It is the 5th leading cause of death. African Americans race has the highest rate of Alzheimer's, which is what we found out. And the Alzheimer's disease mortality rate varies from age, sex, race. It really doesn't matter. Anybody can get the disease.
No one's immune.
Now we look at this graph. Many of those suffering from Alzheimer's are between the ages of 65 and older, but of course there are other cases where it's younger ages. In the United States, there's an estimated 5.5 million Americans of all ages that have Alzheimer's disease since 2017. Now, Alzheimer's disease is currently ranked as the 5th leading cause, and according to the CDC, which is the Centers of Disease Controls and Prevention, Alzheimer's has been a disease that continues to increase in mortality rate compared to other causes such as heart disease or strokes. Next graph. Here, it's based by races. So as we age, the possibility to die from Alzheimer's keeps increasing. Reports show that blacks are about 2 times more likely to get Alzheimer's than those white population. And Hispanics are about 1.5 times more likely than white population. And then here's the map of the United States. Like mentioned before, unfortunately, Alzheimer's can attack anybody. The death rates do not show a specific geographic pattern. As of 2010, which is the most recent information, Washington has the highest death rates for Alzheimer's, so don't go live in Washington, at a 43.6%, followed by Tennessee at 38.5% and North Dakota 37.2%.
Signs and symptoms.
Okay, so signs and symptoms. Alzheimer's disease has mild, moderate, and severe forms of Alzheimer's. Some mild forms are memory loss, confusion about places that they once, were familiar with. They take longer than usual to complete everyday tasks. They have issues with payments, with money. They experience personality changes, which affects their mood. Some moderate symptoms of Alzheimer's are confusion, increased loss of memory, the inability to focus on things, they have shortened attention spans, they have outbursts of anger, signs of depression, they have issues with reasoning, learning new things. They experience confusion, anxiety, restlessness, agitation. They have problems with wandering. Some other symptoms are irritability, paranoia, suspiciousness, hallucinations, delusions. They have issues getting dressed in the morning, maybe even setting up a table in the evening. Some severe symptoms are excessive sleep, trouble swallowing, weight loss from forgetting to eat and drink, incontinence of bowel and bladder, moaning, groaning, grunting. They may have issues speaking, they'll forget words, things like that. And they will be dependent on others for assistance with activities of daily living, like maybe getting dressed, eating,
Going to the
going
grocery
for
store,
a
any
walk.
kind of tasks, any basic task that requires more than maybe 2 steps, they're gonna need help with it after a certain point of the disease.
Okay, so some tests or experimentations. Well, there's many different tests, and as you know, you go see your doctor. The doctor will ask about your medical history. If anybody in the family has Alzheimer's, they'll basically assess the patient. They'll ask them what kind of medications they're taking. They'll check their blood pressure, pulse, respirations, weight, temperature, check if they're diabetic. They'll do the hemoglobin A1C test. They'll also want to do a neurological exam. They'll check the patient's speech, eye movement, sensation, reflexes, strength, muscle tone, and coordination. There's other tests such as the mental status test, and it's basically to check to see if the person is alert and oriented to person, place, and time. There's the MMSE, which is the mini mental state exam, and the mini cog test. The MMSE entails being asked a series of questions. These questions are to gauge their everyday mental skills. The scores range from 30, which is the maximum amount of points, and below. A score of 20 to 24 indicates the patient is presenting signs of mild dementia. A score of 13 to 20, moderate dementia, and less than 12, severe dementia. Okay, and there's also computerized tests that are used as another tool. And it's basically, what they'll do is they'll ask questions to the patient. They also have mood assessments to detect if there's other mental health issues. And brain imaging, there's MRI, which is magnetic resonance imaging, and CT scans, which is computed tomography scans, to determine if there's another disease or condition that could be causing similar symptoms to Alzheimer's. And basically, like, when they do these imagings, they'll look for beta amyloid. Our differential diagnosis is Parkinson's disease, and basically, it's also a neurodegenerative disease. And these patients, they'll experience issues with rigidity, trouble walking. They might stop in their tracks when they're moving. They have stoop posture. They also tend to shuffle when they walk.
A lot of loss of motor control when Alzheimer's is not only motor, it'll also be mental as well. But usually people with Parkinson's at least know what they want to say or do, just can't get it to work. So that would be the main difference.
But they too also have issues with depression, anxiety. They might have hallucinations, problems with incontinence.
Okay. So the actual diagnosis, there's not one specific test in order to tell if you have it because there's so many factors that come into play. But like she was saying earlier, the mini mental state exam is one of the main ones, and the Montreal Cognitive Assessment tests are also they're baseline tests in case a physician feels that they might have some neurological issue to begin with. The sooner a patient can get tested for Alzheimer's, the better, because they have shown that issues can start up to a decade before they're even presented anywhere else other than a CT scan. So, let's see. Treatments, let's see. There's about 2 medications that are FDA approved. Well, there's a total of 5, but FDA approved, but they don't do much to slow down or cure. They're just meant to kind of help with the symptoms to deal with them better. Omega-3 fatty acids, Carusim, ginkgo, and vitamin E. But a lot of alternative medications or methods that have been used are daily practices, reading a book, gardening, going out and exercising, crossword puzzles, daily activities with friends. Just those little things will help keep your mind sharp. So if you do already have it, you can slow it down as much as possible.
But some of the medications that they say will actually help slow down the progress of Alzheimer's would be like memantine, donepezil, other cholinesterase inhibitors.
And then well, also proper diet as well helps out, and exercise, because you're keeping not only your mind active but your body active as well. As we've all learned in anatomy, everything's connected in one way or another. Let's see. For the prognosis, no meds at the moment can cure it, only slow it down by a little. Right here you can see we have a healthy brain, and then after severe Alzheimer's have affected it, it's almost eaten away more than half. Most patients, after being told, have anywhere from 1 to 20 years to expire from it, but the average is 4 to 8 average years after being diagnosed with it. For conclusion, Alzheimer's disease is a neurodegenerative disease that has no cure. People lose themselves in the memories of the persons, places, and things they once held dear. Confused, agitated, and depressed are some of the signs that they display. Withering away until there is not much left from the failure to eat and drink, losing control of their bladder and bowel movements, forgetting how to communicate, reaching the stage of dependency on others for activities of daily living. Alzheimer's disease. Long goodbye.
Long goodbye.
And then our references.